Hello everyone, how are you? Welcome to another question and answer session. This is the physiology. A 43 years old man or lady undergoes a day case laparoscopic cholecystectomy. So it is an operative procedure. Operation is more difficult than anticipated. That means there is risk of injury of the different structure than the anticipated, and drain placed to the operative site. Whilst in the recovery, the patient loses 1800 ml of frank blood. That means fresh blood 1800 ml, which is about 2 liter. Which of the following will not occur? So after this condition, what will not occur in this patient? Here the options are release of aldosterone via Bainbridge reflex, reduce urinary sodium excretion, increase in sympathetic discharge to ventricular muscle, fall in parasympathetic discharge to the SA node, and decrease stimulation from arterial pressure receptor. So now we have to find out one of the option which will not occur in this lady. And this lady undergone an laparoscopic cholecystectomy and suddenly lost 1800 ml blood in post-operative period. So we have to find out the consequence of the blood loss. So first of all, when blood loss, that means when the blood volume reduce, in this condition there is reduced blood pressure. When there is decreased blood pressure, in this condition the arterial pressure also decreases. When arterial pressure decreases, the arterial pressure in the kidney also decreases. That means in the renal artery and the branches of renal artery, the pressure also reduces. And in this condition, first of all, renin release from the kidney, and the renin acts on the angiotensinogen, which was preformed from the liver and circulating in the blood, and the renin converts this angiotensinogen into angiotensin 1, and this angiotensin 1, it goes to the lungs, and when it goes to the lungs, there is an important enzyme which is the angiotensin converting enzyme, and this angiotensin converting enzyme, it converts the angiotensin 1 into the angiotensin 2, and this angiotensin 2, it acts on different level in our body power system. So first of all, here we can see three important organ. One is the kidney, another one is liver, and another one is the lungs. So kidney, liver and lungs, they play important role in this condition where there is blood loss, decreased blood pressure. And in this condition, first of all, in case of kidney, renin secretion occurs, and renin acts on the angiotensinogen. This angiotensinogen released from the liver, and the renin converts the angiotensinogen into angiotensin 1. When angiotensin 1 goes to the lungs, there it is converted to angiotensin 2 by the angiotensin converting enzyme, and the angiotensin 2, it exerts the desired action. Here first of all, we can see the renal retention of salt and water. That means the sodium and water. So sodium and water, they are reabsorbed in the renal tubule. So in the urine, there is less amount of water, less amount of sodium ion, and it also acts on the blood vessel, and it causes vasoconstriction to increase the blood pressure, increase the volume, and finally increase arterial pressure. So it is the one of the most important mechanism, and which also known as the RAAS, which is the renin angiotensin aldosterone system mechanism. And through this system, usually when blood pressure drop, by this mechanism, it is possible to gain the increased blood pressure. This is the another figure, and it is showing same type of mechanism. When there is blood volume decreases, blood pressure decreases, then arterial pressure decreases, and glomerular hydrostatic pressure also decreases, GFR decreases, and macular denser sodium chloride decreases. For this condition, renin secretion occurs, and finally activates angiotensin 2, and it increases efferent arteriolar resistance and it decreases afferent arteriolar resistance. And another one is the Bainbridge reflex. The Bainbridge reflex, it increases the heart rate. Bainbridge reflex is increase the heart rate. Why? Because there is less volume, but we need more oxygen, more food material. For this condition, through the Bainbridge reflex, heart rate increases and the circulation increases, and it mediates via the arterial stress receptor, and following it may also occur following a rapid blood transfusion. So finally our answer is ready. Aldosterone via the Bainbridge reflex, it is not true, because aldosterone, it is released by a system which is the RAAS system, which is the renin-angiotensin aldosterone system. Urine reduce urinary sodium excretion, it is also true, because the angiotensin 2 and aldosterone, they increase reabsorption of the sodium and water. For this condition, urinary sodium reduce. Increase sympathetic discharge to ventricular muscle, it is also true, because the ventricular muscle it increase its activity by sympathetic discharge. And fall parasympathetic discharge to sinoatrial node, it is also true, because heart rate should increase. For this condition, sympathetic supply increases and parasympathetic supply decreases. And decrease stimulation from the arterial pressure receptor, it is also true, it is the pressure receptor. So when there is pressure receptor, that means it is pressure by the blood. As this is the blood volume reduced, so pressure reduced, so stimulation of the arterial receptor also reduced. Thank you.